Great, hi everyone. Just start off by thanking Rick and the team at Beacon for inviting myself and Joe to give this talk this evening. So really we want to really use this opportunity to talk about a local roundtable discussion that we hosted towards the end of last year. And it was focusing on improving the transition from paediatric to adult care for young people living with rare diseases. So just a brief overview of the things we're going to talk through. So I'll give a very brief intro on the project background, and we're very fortunate that Katie Callahan, who's one of the attendees at the roundtable, has very kindly prepared a short video for us tonight telling us about her first-hand personal experience of the transition processes and some of the challenges. We're going to talk about the roundtable meeting itself and the sort of key challenges and solutions that were identified, and then move on to discussing some of the key recommendations. So, brief background. So, as I'm sure many of you know, there are sort of estimated to be around 3.5 million people living with a rare disease in the UK, and at the age of 16 to 18 years, many of those individuals will go through the transition from paediatric to adult care. And there are a few sort of descriptions of what transition is, but one that we took in preparation for the meeting was really looking at it as the purposeful and planned movements of adolescents and young adults with chronic physical and medical conditions from child-centred to adult-oriented healthcare systems. Many of you will be familiar with the Rare Diseases Framework, which was published in 2021, and this did acknowledge the importance of a successful transition, but we're aware that there are still many challenges associated with transition, especially in those people living with rare diseases. Earlier this year, England's first Rare Diseases Action Plan was published with plans to update this over the coming years, and we feel that this is really a good opportunity to advocate for improved transition. So, as I mentioned, I'm going to start by sharing the first part of Katie's story that she's very kindly recorded for us this evening, giving a sort of personal reflection on some of the challenges that she faced.
For me, transition was never really mentioned. I didn't really have a transition, I was just sort of thrown into the deep end. So I think when I reached 16, I mentioned it to my doctors myself because I was a little confused why it sort of hadn't been brought up. To which I was told they had forgotten about it. So from the start, it was something which wasn't planned out well, wasn't thought of. It was literally just forgotten about from the beginning. I had a few positives. I did meet one of the adult doctors I would be under, which is really important for us. But cutting a long story short, my transition happened basically by me becoming pretty ill sort of just after my 16th birthday. I went to the children's A&E department at my hospital as I was still under them. I was told by my team to attend the children's department still, but when I arrived there was just a complete lack of coordination of care, which I think is something that is really highlighted in this document. Instead of caring for me, everyone was sort of just arguing about whether I should be in adults or children's, whether I should be seeing adult doctors or pediatric doctors, instead of someone actually focusing on me. And this unfortunately meant I became sort of seriously ill, resulting in a trip to resus and then the children's intensive care unit. And this all could have been avoided simply by someone taking responsibility of my care and someone taking responsibility and control of my transition.
Okay, so just to give a brief overview of the roundtable meeting. So it was hosted over at our Costello offices just across the road from here on the 15th of October last year in collaboration with Cambridge Rare Disease Network and Beacon. And we were very fortunate to get a fantastic group of 14 participants there for this half-day in-person meeting, representing a range of stakeholder groups from the local region. So we had healthcare professionals, patients, parents, policy experts, patient advocates. We had a medical consultant, and we also had a youth worker there from Colchester. And during that half-day discussion, Participants were really encouraged to describe their own experiences and insights in terms of the transition process, to identify what were considered to be the sort of key current challenges in that process, and then moving on to looking at potential solutions to address some of those challenges. And at the end of the meeting, we then agreed on a set of key recommendations and actions to really improve the transition pathway. And the outcomes from the meeting were published in a report earlier this year, and you should all have a copy of the report in your delegate bags. There's also, at the very end of the last slide, we have a QR code which takes you to a link to the online version. So just to briefly sort of recap on some of the challenges, many of which have been highlighted very nicely by Katie in her video. These are the sort of key challenges that were pulled out, and some of the quotes from some of the attendees. But really, firstly, just defining actually what transition is and defining it as a process rather than simple transfer of care. There was a lot of discussion about the lack of coordinated care and need for more coordinated care, a lack of transparency and communication around the process and what to expect, timing of transition, the sort of changing role of parents during that transition process, limited consideration of the individual's well-being beyond the sort of health condition itself. There's a lot going on in teenagers' lives beyond their sort of physical health. There was definite identified sort of fear of moving to adult care as well, and a lack of age-appropriate care, which is highlighted a bit later on in one of our case studies. And I'll just, before I hand over to Jo, just play another part of Katie's story.
I think it's experiences like mine which make me feel as though it's so important to have us, the young person's sort of voices heard and at the centre of our transition. I think so many young people get lost in the system or forgotten about during this process. And with rare disease, it makes it even more complicated. When you're under multiple different specialities, I think, for example, I was under sort of adults in one hospital, pediatrics in another, and pediatrics in the community, adolescents in a different hospital, all these different paces in all different specialities in different hospitals. It's confusing and it's stressful, and I think life for young adults is complicated and confusing enough when you live with rare disease, and throwing in a negative transition experience just complicates this for us even further.
Moving on to solutions, the whole point of this roundtable meeting was to develop some ideas for next steps. So the team that we had around the table offered some of their own ideas and solutions. I won't read them all out for you. You can read and they're in the report. But I think if I was to pick out some of the highlights from this, it was really about right time, right people, right approach. What we mean by right time is doing things early enough to kick a process into starting, to make sure that you've got those right multidisciplinary collaborative teams together. And key about having the right people involved. So all of the young people that we spoke to in the focus groups prior to this roundtable and on the day were saying, we need people who can speak our language. And it's hard when you're our age to kind of think back to, you know, what were our priorities when we were young? What were the things that were important to us then? And you'll find that they are very different from where we are now. So having a youth worker was one thing that was really advocated for, and it was something that they had at Colchester Hospital. But we also saw that at Addenbrooke's at the cancer ward. So if we can move on, thank you. We took this as a case study in the report. This is Addenbrooke's Hospital. They have a teenager and young adult cancer ward. It comes with a lot of funding, which does help. But some of the things that they could share with us that they felt had really helped were building an environment that works for young people. So as you walk into this hospital, it has lots of things that young people said they wanted. It's got comfy sofas, it's got a jukebox, it's got a pool table. You know, little things that make a difference and make it feel like home. It's very colourful. It's got kitchen facilities. But most importantly, it takes a very holistic look at how we care for young people. So for example, they offer mental health support as part of their package, and you can choose how you have that. So if you're a young person who's very private, you want to speak to somebody on a one-to-one, that's available. If you would prefer to be in a group situation and actually share with other young people, that's possible too. If you want to do it by video call or even by text, that's an option. So it's about providing some kind of personalised care, something that really hooks in that young person. What else have we got there? I think that's okay, if we can move on. So from the solutions that were suggested to us by the group, we came up with 4 key recommendations. So we're really advocating today for strengthening the coordination of transition. I think we're advocating for the coordination to be better generally for everybody with care, with rare diseases, but in particular at that crucial time when they're having to move on. Ensuring that the process begins early and allowing for flexibility, especially where it's a complex condition. There might be lots of teams involved, there might be lots of hospitals involved. You need to make sure that everybody's talking to each other in advance. Invest in the development of age-appropriate services, so back to talking the language of young people, making sure that you're doing things that actually suit them and their time of life. And holding services accountable. I think this is everyone's responsibility, making sure that you understand what good transition should look like and holding people accountable where they need to be held accountable. Move on. So there's a lot in this and I'm not going to read it all out, but instead I'm going to ask you, the audience, what do you feel in your role you can do to move this forward? We've given lots of suggestions in the report itself, and we've taken each of the different stakeholders that might be here tonight, but I'd like to hear from you. If you were a person living with a rare disease, or you're a parent or a carer, perhaps you run a patient group, what do you think your responsibility is, and what do you think you might take away from today or from the report that you could do in your own practice? So some of the key messages: to start early, to involve the family and the young person, to make sure that we're building in people like youth workers into the service so that we have the right people talking to young people. And if you are an industry professional, perhaps you can be thinking about, how can I sponsor or support a programme of transition? How can I make sure that these people are embedded into the service if they're not already funded? Policymakers, making sure that the NICE recommendations for transitions are listened to and are being applied. If they're not, hold people to account. So it's all of our responsibility to make sure that the right thing is happening and to take action.
Thanks, Jo. I realise we've overrun a little bit, so I'm going to skip the next slide and just acknowledge all of those attendees at the meeting, including people like Lawrence, who really contributed to those discussions. So thanks to everyone there, and to Rick and Jo, who also chaired those discussions. And finally, say thank you all for listening, and I hope you enjoy the rest of the showcase. And here's a QR code if you wanted to download an electronic version of that report. And please do come and speak to us during the networking bits if you want to find out a bit more.